Hola, buenos días a
Good
todos, a
morning,
todos.
everyone.
Buenos días,
Hello,
buenos días.
hello.
Les
Welcome.
habla Gustavo Pérez.
This is
Soy el asesor
Gustavo
regional de
Perez. I
discapacidad
am the
para la Comisión
regional
Panamericana de la
assistant
Salud.
for
Y
regional advisor for
efectivamente
PAHO, also with
hemos
Liliana
organizado
Vasquez.
este webinar
We have
para
organized this
hablaros
webinar
alrededor
to
del cáncer infantil y la
talk to
discapacidad.
you
Muchísimas
about
gracias, bienvenidos a todos
disability
y a
and
todas los que
childhood
vais
cancer. So welcome
viniendo a este
everyone,
chat,
all of those
a
who
este
are
webinar.
joining
Podéis
in.
escribir si queréis
You may
en el
write
chat,
on
os
the
podéis
chat if
presentar
you
quiénes
want. You
sois,
can introduce yourselves.
desde qué
Who
país os
who
unís, en
are
qué
you? Where
organización
you coming
trabajáis.
from, so that we can see
Y
you.
justo también en la barra de
And
abajo de vuestras
also
pantallas
in the bar on the lower part of
podéis
the screen, you
encontrar,
will be
que ahora
able to
mismo no lo veo, no sé si
find
lo podemos activar, el Q&A,
the
preguntas y
Q&A
respuestas para hacer vuestras preguntas
button. That is, you
a lo
can
largo
ask your
del
questions there
webinar de hoy.
throughout the webinar.
También tenéis en la barra de
Also,
abajo
you have on the
un
lower part
símbolo
of the screen, there's a
que es como una
symbol
esfera con la
that
vuelta de
it's
un
like
mundo,
a
donde podéis
sphere, a
encontrar
world,
los
where
canales
you
de
can choose the
interpretación,
languages
tanto en español, en
for the
inglés
interpretation
y como
channels,
veis
that is
también en
in
la
English
pantalla,
and in
en lengua de
Spanish.
señas. ¿De
And
acuerdo?
as you can see on the screen, we also
Así
have
que bueno,
ASL.
muchísimas gracias
So
por vuestra
thank you very much
presencia. Bienvenidos de
for
nuevo,
being here with
bienvenidas.
us. Welcome, welcome everyone.
Ya veo cada vez más
I
participantes.
see
Genial, de
that we
muchísimos
have more
países.
and more
Bienvenidos.
participants joining in from many
Estupendo.
countries.
Pues bueno, pues antes
So,
de
well,
comenzar le
thank
vamos a
you.
ceder la
And
palabra a mi colega
before
Liliana
starting, we're
Vázquez,
going to
la
pass the
responsable
floor
técnica
to
del cáncer.
Liliana
Adelante,
Vasquez,
Liliana, cuando
who
quieras.
is the technical officer
Muchísimas
in
gracias,
PAHO.
Gustavo,
Good
y buenos
morning,
días y buenas
Gustavo,
tardes a
and
todos.
hello,
Es un gran
good
placer estar
morning,
con
good evening.
ustedes en
It's
este
a
día
great
tan
pleasure to
importante
be
para
here with you
nosotros,
in
muy
this
esperado,
important day for us.
como
This
decía
was
Gustavo, con mucho
something that we
esfuerzo,
were
mucho
expecting
cariño,
a
hemos
lot.
podido
It was
organizar este webinar
organized.
con
We
Palliative
organized
de
this
lujo y nos
seminar
acompaña el día de hoy
with
en este webinar de
great
discapacidad y cáncer
speakers.
infantil de la supervivencia a la inclusión plena en
And
América Latina y
the,
Caribe.
the, the
Muchas
title
gracias
is
a todos
Disability and
por,
Childhood Cancer from
gracias
Survival to Full
por dar su nombre,
Inclusion
sus
in Latin
cargos,
America
sus
and the
países.
Caribbean. Thank you
Las
so much
reacciones.
for
Estamos muy
presenting
contentos
on
de
yourselves on the chat.
acompañarlos hoy,
We are so excited to be
principalmente
here
porque
with you,
celebramos
mainly
que
because we
realmente
are
cada vez
celebrating
más
that
niños,
more and
niñas,
more
adolescentes sobreviven al cáncer, ¿no? Sabemos que
we have
gracias a los
more survival
avances del
rates from
diagnóstico y
childhood
tratamiento y
to
en los fortalecimientos de los
teenagers,
sistemas de
and
salud
we want
en
to
la región,
strengthen all the
particularmente en
health
América
systems
Latina y
in the
Caribe,
Latin
hay
American and
muchos
the
más
Caribbean
niños
region.
que
We see
sobreviven
a
y que
lot
pasan
of
tratamientos
children that
oncológicos
are
y llegan a ser
surviving,
sobrevivientes de cáncer
and
infantil.
and
Pero
they go
esto no es el
over,
final del camino.
about
El
they go over
desafío
oncology
empieza
treatments, but
realmente
the
cuando
challenge
uno debe y
starts really
puede
when
garantizar
we
que
have to
esos
guarantee
pacientes,
that those
estas personas puedan
survivors, all
desarrollarse
these people may
plenamente,
be able to
puedan
develop
participar en la
themselves,
escuela, en
they
su
can
comunidad, alcanzar un
participate in
máximo
their
potencial.
schools
Entonces
and
ahí
in their
el
society,
esfuerzo
the
conjunto de
community. So this is
asociar
a joint
cómo es que
effort
podemos
to link
enfrentar este
how
reto de
can
la
we face
discapacidad y
all
el
of these
cáncer
challenges
infantil.
of
Es muy
disability
necesario estos
and
diálogos, ¿verdad? Están
childhood cancer.
estrechamente
These are
relacionados
very
tanto la
important
discapacidad como un
discussions.
producto muchas
And it's not
veces
only
de
about
los
disability,
tratamientos
but also
intensos
the intense
oncológicos que se
treatment
dan
that
con
they need to
pacientes como
undergo,
quimioterapia,
like
radioterapia,
chemotherapies,
cirugía,
radiotherapies,
trasplantes. Entonces,
surgeries,
muchos de los
transplants.
pacientes
So many of the children,
sobrellevan efectos
they
adversos,
have to
incluyendo, por supuesto, muchos tipos de discapacidad que vamos a
cope
conversar
with
el
a
día de
lot
hoy,
of
que requieren servicios de rehabilitación,
late
que
effects,
requieren
and
un
they
apoyo
required
psicosocial, adaptaciones
psychosocial
a largo
adaptation
plazo,
help,
para
and they
que
have
puedan
to adapt
desempeñarse y
themselves
superar muchas
so
barreras
that they
para
can
acceder
overcome a lot
oportunamente a
of
una atención de
barriers
calidad. Y por otro
in
lado,
order to be able
también
to have
cómo
a
es que la
good quality of
discapacidad
life.
puede
And
ser
how, for
un
example, this
factor
disability may
deleterio
be
muchas
able a
veces para
factor
el acceso a un
for the
tratamiento
access of
oncológico
an oncological treatment
oportuno y de
that
calidad.
it's
Entonces, en ese marco,
quality,
pues,
of
de
great quality
trabajo
and on
desde
timely
la
basis.
OPS,
So
estamos
the work from
comprometidos
the
para poder
from PAHO, we
seguir
are committed
avanzando
to be able
con
to
los
work with
países y poder
all the
promover
countries
estrategias
and
de
to
inclusión
promote
que forman una
inclusion
parte
strategies that will be a
estratégica
part of
integral de la
these
atención,
integral
particularmente de los
care
pacientes oncológicos, incluyendo
that
los
we
niños y
provide to
adolescentes, desde
all childhood
asegurar
cancer
mejor
survivors,
diagnóstico hasta
ensure
mejorar la atención de
a
los sobrevivientes de
diagnosis,
cáncer
and
infantil
also
con un
to
enfoque
ensure
de derechos
survivorship
humanos, de equidad, de
from
protección
the
social.
equity
Entonces,
point of
ese
view,
es nuestro
inclusion,
mensaje
etc. So this is our
inicial,
main message.
porque ninguno ninguno de nosotros lo puede lograr
because
solo. Es un
none
trabajo
none of us
multisectorial. Se necesita
can
mucha
achieve this
colaboración
by
y es por eso que
ourselves.
hoy
We need a lot of
tenemos panelistas que nos
collaboration,
van a ilustrar
and this is
desde
why we
la
have
sociedad civil,
panelists from the
desde el
civil
enfoque
society, from
hospitalario
the
también,
hospital
desde
point
los
of
enfoques de
view,
sobrevivientes,
also
desde
from the
las redes
survivorship, from the
de atención
networks
y
of
promoción de derechos
care
de las
and
personas con
promotion of
discapacidad, cómo
rights,
esto
from the people of
esta colaboración puede
societies,
promover
and how this
esta mayor
promotion can
inclusión. Así
help
que
us
por eso muy
to be
contentos
able
de
to
reafirmar
work
este
with
compromiso
everyone.
con todos
So we
ustedes y
want to
con los
reaffirm
países
this
y
commitment with
que este
everyone.
webinar sea
And the
de mucho
idea is that
provecho
this
para
webinar can
todos
be
nosotros
very
en este trabajo.
beneficial
Con eso le voy a dar de
to
nuevo
everyone.
pase
And
a
with this,
nuestro
I'm going to
querido
pass the floor again
Gustavo
to our
Reina,
dear
asesor
Gustavo,
de rehabilitación y
who
discapacidad de la
is
OPS.
a
Adelante, Gustavo.
regional advisor
Muchísimas
for
gracias,
PAHO.
Liliana, por estas
Liliana,
magníficas palabras de
thank you
apertura.
so
Yo creo
much
que
for this
has dado el
opening
mensaje
words. I
clave, ¿no? Es
believe that
decir,
this is a key
cómo podemos
message.
integrar
How can we
tanto la
integrate
discapacidad como el cáncer infantil para realmente
disability
desde
and
este área
childhood cancer to
multidisciplinar
really
ofrecer
have
las
this
mejores perspectivas y calidad de vida para esos
multidisciplinary
niños y niñas,
view,
¿no? Yo
and
creo
we
que
can
esta es la
provide the
clave.
best care
Bueno, y para
for
ello
all
hemos
our
contactado
children.
desde la OPS con
So
un grupo
we have
maravilloso de
a
expertos que nos
great
van a apoyar
team, a group of experts
precisamente a lo
that will
largo de este
help us
webinario, donde
to
vamos a
throughout this
desarrollar una serie
webinar, and
de
we will
preguntas
be
para
asking them a
realmente
series
analizar
of
en el
questions
contexto
so
de
that
cómo
we can
podemos
have a
ofrecer al mismo
context.
tiempo
How can we offer
recomendaciones a
them
este sentido.
key
Para ello tenemos
recommendations?
con nosotros
For
una serie de
that, we
panelistas expertos de
have
la región.
a
Como os digo,
expert
contamos con
panelist.
la presencia de la
We
doctora
have
Suad Fuentes Alavi, que es
the
oncóloga
presence of
pediátrica,
Suad
máster
Fuentes
en salud
Alawi.
pública, directora
She's
regional
coming
del St.
from
Jude Children's,
the
Salud
St. Jude
Children's Research
Global's
Hospital
St.
en
Jude
Inglaterra.
Children's Research
Contamos
Hospital.
también con la presencia de Carlos
Have
Frías, el
Carlos
expresidente y
Frias.
fundador de
He
la
is
red
the founder and
latinoamericana de
president
sobrevivientes
of
de cáncer infantil,
the
Faros de Vida.
Faros
Bienvenido,
de
bienvenida,
Vida.
Carlos. Muchísimas gracias por estar con nosotros.
Carlos, welcome.
Tenemos también a Marcela
We also have
Zubieta.
Marcela
Ella es
Zubieta.
fundadora y presidenta de
She
la
is a
Fundación Nuestros
founder and a
Hijos en
president
Chile.
of Fundación
Además, ella es
Nuestros Hijos
pediatra,
en Chile.
infectóloga con una
She's a
amplia
pediatric
trayectoria en
and also
oncología
with a long
pediátrica.
experience
Y
on
también tenemos con
oncology,
nosotros a Juan
pediatric
Ángel del
oncology. And
Bobella. Él es
also we have
presidente
De
de
Ángel
la
del
Red
Bobella. He
Latinoamericana
is
de
the
Organizaciones de
president
Personas con Discapacidad y sus
of
familias. Además, él es
RIADIS,
vicepresidente de la
which is the
Alianza
Latin Network for
Internacional
Organizations of
por la
Persons with
Discapacidad
Disability,
y miembro
and
de la Junta de la
member
Federación
of
Mundial de
the
Fondos,
Federation of
además de miembro del Fondo Mixto de la
Fund of
Organización de
Plus,
Estados
the
Americanos.
mixed funds of
Bienvenido,
the
Juan Ángel, un gusto
oh yeah,
saludarte
so
también.
Angel, welcome.
Desgraciadamente, por cuestiones técnicas, pues
And
no
due to
puede
technical
prender la cámara, pero bueno, aquí está él con nosotros.
reasons, he cannot turn
Y
on
bueno, sin
his
más
camera.
dilación, vamos a comenzar
But
ya con
without
el
further
primer
ado,
banco de
let's pass
preguntas que van
with the
alrededor
first.
de la
Let's go
perspectiva
with the
internacional.
first
Y luego le
questions.
cedo la palabra a mi
The
colega Liliana.
international
Adelante, Liliana.
perspective. So Liliana, you have the floor so that you can guide this
Muchísimas
webinar.
gracias, Gustavo,
Thank you,
y gracias a todos
Gustavo,
nuestros
and thank
panelistas
you
por estar
everyone
presentes el
for
día de
these
hoy. Nuestra
for
primera
our
pregunta
experts.
va
So
para
the
nuestra
first question is
querida
for our
colega Suad
colleague
Fuentes del
Suad
Hospital de St.
Fuentes
Jude y
from
de
St.
su rol
Jude's
como
Children's
directora
Research
regional
Hospital
para
as the
Centroamérica, para
regional
México,
director
desde su
for Central
experiencia,
America and Mexico.
¿cómo
Can you share your
describiría
experience? How would
las
you
brechas, ¿verdad?
describe
Vamos a hablar
the
un poco
gaps if we
sobre las
talk
brechas,
about,
los
for example,
desafíos a nivel
first the
internacional
gaps and the
en el abordaje
challenges
del cáncer
that we
infantil cuando
face
pensamos en
with
discapacidad, cuando
when we
pensamos en
think
una
about
secuela o
disability, when
condición
we think
previa?
about
Adelante, Suad.
effects, late effects? Thank you, Lily. Thank you, Gustavo, for this invitation. This is a topic that we need to strengthen for our patients and our survivors. You know that with all these advances, we need to improve. We have more survivors, and they are going to be affected by some of the late effects due to the treatment. One of the main things that we need to do and to reorganize ourselves, and we need to, sometimes the interventions can happen in a reactive manner. And the interpretation booth apologize. We can hardly hear the doctor, so we are going to try to do our best. So possibly sometimes where patients may receive their rehabilitation treatments, and to include mechanisms so that they can be reinstated into the society, into the community. So we have to work all together. And this is one of the main, and this is one of the challenges that we have in the region. There's a lack of organization in terms of how do we treat patients. There's a lack of access, the instruction, and this is something that we may have to include and to strengthen capacities and from the disease or from the treatment, there's a lack of support to strengthen their, I mean, they can suffer from different diseases. So what we can do is to strengthen participation so that families from the beginning not only can be able to receive help, but also that they are part of a active care plan, and that we have to learn how to identify the things that we need to get ready to so that the patients, once that they treat, I can see that in the chat they're saying that they can hardly hear me.
Sí, quizás
Let
subir
me,
un poquito el
yes,
volumen,
can
a lo
you
mejor
please
de su
talk a little
computadora.
bit louder because we can hardly hear you? Let me know.
Se escucha un poco bajo, pero yo lo oigo bien.
As I was saying, from the minute that the patient ends their treatment, our duty does not end there. As pediatric oncologists, we cannot only say, okay, you are done. You have to know that this is just the beginning of a path, that they need to go back to their regular activities, that is school, society, and we need to strengthen that. Sometimes there are not enough mechanisms where families can go to so that they know how to work with this. It is important that we work from the beginning of treatment to know exactly what's going to happen after treatment, to involve family members. They have to learn about all the mechanisms that we have so that they can learn what they need to do afterwards so that they can have a plan, that this could be included into the next steps to take. And this is beyond treatment. This includes, for example, how to get ready to identify, for example, what the child may need in order to be able to adjust themselves again to the daily activities. So at least this is what I consider. And this initiative is very important, and also to be able to start reorganizing services in such a way that we can create a new rehab program. This means to connect with what we already have and to be able to participate on their functional needs. That is, that we need to ensure that each discipline, they have all disciplines so that the children know how can they go back to their daily activities. When we do this and we have clear objective that is not only to survive cancer, but also to learn how to live afterwards and how to have a good life after enduring treatment.
Muchísimas gracias, Soat, por la
Thank you
respuesta
very
y por
much,
esa
Soad, for
perspectiva de
sharing your
alguna manera
answer and giving
regional,
us a
internacional,
regional perspective,
de
an
ese tema
international
tan
perspective
relevante. Y también los
of
invitamos
this
a
very
los
relevant
participantes a que sigan
issue.
colocando su
We
nombre y
would
su
also
cargo
like to invite everyone
y
to
su
continue
país.
participating. Tell us
También están preguntando sobre la interpretación
your
del inglés. Tenemos
organization,
interpretación en
your
español, inglés y el lenguaje de señas. Así
country,
que
and
muchísimas
we
gracias.
also have some questions
Vamos
about
a seguir
interpretation. We have
con
interpretation
Marcela
into English,
Subieta,
into
nuestra querida
Spanish.
Marcela,
We also have
desde
sign language
Fundación Nuestros Hijos y de
interpretation.
la sociedad
And next, we
civil.
will listen to Marcela
¿Qué
Subieta,
lecciones
civil
de
society
este
organization,
tema crees que
Fundación
nos puedas
Nuestros
dar
Hijos.
de
So, what
iniciativas
key lessons
globales,
from
iniciativas
global
regionales
initiatives do
en tu
you think
experiencia, cómo
are
abordar el tema de
more
la
useful?
discapacidad
So, how
y
do
cáncer
we
infantil desde el
tackle
punto de vista de
disability and
cooperación?
childhood
¿Qué
cancer
pueden ser
in
útiles
terms of
para países
cooperation? What do you
de
think could be the
ingresos
most
medianos y
useful
bajos,
for low
que
and middle income
generalmente es lo que
countries
vemos en nuestra
in
región?
our region?
Adelante, Marcela.
Thank you, Marcela. Thank
Thank
you, Liliana, and thank you, Gustavo, for the invitation to be here. It's an honor and a privilege to be here talking about this very important topic that has interested us for many years. And the first thing I would like to say is that many countries in our region have important challenges in terms of timely detection, diagnostic tools, also early quality treatment, and these, of course, can always help survival rates. So these parameters in our regions are not the best. And this is also true in other countries around the world. And that's why rehabilitation, talking to Dr. Rodriguez from St. Jude, is really at a very early stage. So let me share what Fundación Nuestros Hijos has done. We are celebrating our 35th anniversary this year. And for the past 14 years, a colleague and friend has been telling me that children with brain tumors never really went for their follow-up visits to the oncology department. I cannot even think of having these children in bed, eh, losing their lives without having access to this, the possibility of reincorporating into society. And Liliana, we saw the same thing when we were working with Carlo and the rest of the team doing research with the survival and survivors networks. For instance, there were no survivors of brain tumors. And so we really thought there is a lot of work to do. And you brought us together with Gustavo, and here we are. We continue to collaborate to try to improve the lives of children. So, our organization, as I said, or our unit specifically, was created 14 years ago when we came in contact with St. Jude and another organization from Toronto. And we started as a very small unit, which has grown. We now have a very large rehabilitation center, very comprehensive. It offers a lot of specialties. And many years ago, we asked St. Jude to guide us in this area because, of course, we thought we were doing well, but we wanted St. Jude to assess our work. And we were given a profile evaluation. We have a long way with St. Jude. We have the SCORE profile course. We have recently been invited to test a new strategy to measure the impact of our work much better. So, as a foundation, we receive the patients from the oncology department from Santiago de Chile, where about 60% of children with cancer are taken in, and it has become a center that trains professionals for the public sector, but for the majority of the country. And through our own initiatives, we began to collaborate and to support the Ministry of Foreign Affairs in Chile to share the successful experiences of the civil society. And that is how we began our knowledge exchange with rehabilitation. And basically, it was how our first child was born in Guadalajara, Mexico. So the children who still face challenges in diagnostics in countries where maybe the resources economically are simply not available for rehabilitation centers, I think that poses a different challenge. And with the civil society, as we worked in Chile, I think we can begin to train to do capacity building in this area. As a foundation, we have always worked in partnership with the health sector, with the government institutions, so that we help to tackle all the obstacles. Whatever the government cannot do, we can do. And sometimes when we come and support in some way, then the government afterwards responds by setting up their own
Muchas gracias,
program.
doctora
Thank you.
Subieta, por
Thank you very
el
much, Dr.
mensaje y
Subieta,
realmente
for
inspirador todo el
your
trabajo que
remarks.
están
I
haciendo
find
en
the work
Chile.
that
Creo que
you
es un
do in
modelo
Chile
que muchos
very
de nosotros quisiéramos seguir
inspirational, and I
también.
really
Y en esta colaboración
feel
internacional que
like
se está
many of
dando
us would
por
like
pacientes
to really
sobrevivientes de cáncer infantil.
learn from
Y
this
gracias a todos los
international
que se están
collaboration
conectando
that
de diferentes
supports
países.
childhood
Mucho gusto verte.
survivors.
Tenemos muchos
And thank you
colegas
to everyone
y
joining
también
us from all the
líderes de
countries in the region.
fundaciones
It's
de
wonderful
América
to
Latina y
see
el Caribe,
colleagues,
que
leaders of
ustedes tienen más experiencia sobre
organizations in
este
Latin
tema, por
America
favor.
and the
Sabemos que hay
Caribbean.
muchas
We
experiencias
know that
en la
there is
región
a
y aquí en
wealth
el
of
país también.
experience
Con eso le
gathered
doy paso a
here
Gustavo para
today.
seguir con
So
nuestra
please
discusión.
share. And I
Muchísimas
want to
gracias,
hand it
Liliana. La
over to
verdad es que es
Gustavo
sorprendente.
again
Tenemos
to
ya casi
continue with our
400 personas
discussion.
conectadas
It's
y eso habla
amazing to see that
mucho
we
del
have
interés que hay
400
detrás de este tema,
participants
¿no?
here today.
Bueno,
That
vamos a
shows how
cambiar
much
ahora un poco el
interest there
guión de
is
las
in the
preguntas y
topic.
nos vamos a
Now,
hablar
let's
sobre
switch
modelos de
the
cuidados
gears a
y
little bit
prestación de
and
servicios.
let's talk
Esta
about care
pregunta va dirigida
models
para Juan
and
Ángel,
service
presidente de
organizations. And I
RIADIS.
have a question for Juan
Juan Ángel,
Angel,
¿cómo debería ser
president
un modelo
of
de cuidados
RIADIS. So, Juan
integral para
Angel,
niños, niñas
what
y
should a
adolescentes
comprehensive
con
care model
cáncer
for
que
children and
contemple desde el
adolescents with
inicio
cancer look
la
like that
posibilidad de
considers from the
discapacidad, ya
beginning the
sea física,
possibility of a
sensorial,
disability,
cognitiva o
whether
psicosocial,
physical,
y no
sensory,
solo la
cognitive,
curación del tumor?
psychosocial, instead of
Adelante, Juan Ángel.
focusing solely on curing the tumor?
Hola,
Thank you,
sí,
Juan
buen
Angel.
día. Bueno, gracias Gustavo,
Hello,
gracias
good
Liliana y
morning.
bueno,
Thank
a
you,
las
Gustavo. Thank
panelistas que
you,
me han
Liliana,
antecedido acá.
and all
Efectivamente,
panelists
para
who have
nosotros
spoken
desde la
before me.
RIADIS es sumamente
In
importante que se
RIADIS,
considere
we
un
consider
modelo
it
de atención
very
integral
important
para la infancia
to
que
always
pues,
have a
esté
comprehensive care model
padeciendo
for
de cáncer
children
infantil. ¿Por
available.
qué?
Children
Porque no es
facing
solamente la
cancer,
discapacidad puede
it's
aparecer
not
como una
only that there's a
secuela
possibility of
de la enfermedad,
disability as a
también puede aparecer
consequence,
como
as a
una
side
secuela de los
effect of the
tratamientos a
disease,
los que
but
los niños son
also as a
sometidos. Y
consequence of
durante
the
el
treatment that
proceso
the
del
children
tratamiento
undergo.
o
And
durante,
during
digamos, lo que
treatment,
es el transitar del
or as they
diagnóstico
transition, let's
hasta
say,
una
they go through the
remisión, una
process
posible
from
remisión en
diagnosis
algunos de los
to a
casos, se
potential
vive
remission
también
in some cases,
afectaciones que
there are
no
a
necesariamente
variety of
sean una
impacts that
discapacidad
might
permanente,
not
pero sí
necessarily be
consideran una
permanent
limitación
disabilities,
importante de
but
forma
they do
temporal en el
represent a
desarrollo
temporary
del niño. Y es por
limitation
eso
to
que
their
nosotros
normal
consideraríamos
development.
que
And that is why we
un modelo de atención
believe
integral
that
debe
a
considerar la
comprehensive care
participación
model
también de la
should
familia,
always consider
proveer
the
no
participation of
solamente
families,
herramientas
for
para la
instance,
inclusión
so
del
having
niño,
tools
la
not only for
permanencia
the
en el sistema
inclusion
escolar,
of
dependiendo de las
children
edades en
or
las que se
their
manifieste la enfermedad,
permanence,
sino
they're
empoderar
in
a las
the
familias.
education
Nosotros,
system,
bueno, la
but
red de
also offering
organizaciones de
tools to
personas con
empower
discapacidad
families.
y sus
Our
familias, creemos
network,
que el trabajo de las
RIADIS,
familias es
working with
importante,
families,
que
believe that
dándole
it's very
herramientas
important to have the
apropiadas,
support for these
psicoemocionales,
families. If they have the
formativas,
right psycho
puedan entender
emotional
que todas
tools,
las personas
if they receive
necesitan no
training,
solo mejorar la calidad de vida, no
it
solo
will
atacar la
become
enfermedad,
understood that
sino
it's not
proveerles
only
herramientas que
about
le permitan
tackling
autonomía en el futuro.
the
Es
disease
decir, que las
itself, but
personas
also
puedan,
giving people the tools that
que
they
los
will
niños
need to
puedan
keep
ser,
their
desarrollarse
autonomy
como
in the
personas
future. In the
dentro de un
case of children,
espacio
allowing them
ideal.
to continue to
Sabemos que las
develop in the
condiciones
right
hospitalarias, por
conditions.
ejemplo, para
We
la
know
América
that
Latina,
being in
no
hospital,
siempre
for
son
instance, in
las
Latin
más
America
óptimas
means
para la
that the
atención de los
conditions are
niños.
not
Hay
always
países
the
donde no
best
hay
in
acceso a
terms of
todos los
care provided to
tratamientos
children. There are
o a la
countries
medicina
where
de
there
última
simply is
generación.
not access
Entonces, la
to the
medicina
latest
incluso puede
treatment,
generar algunos
and
efectos
this
como
may mean
la
that
pérdida de la audición.
the treatment
Entonces, es
itself can
recomendable
lead to,
siempre
for
que el
example,
modelo
loss
sea
of hearing.
integral, que
That's why
permanezca
we do
atendiendo la parte
recommend
médica
having
y
a
la parte de salud
comprehensive care
sin
model
dejar de
that
considerar los
does
derechos de
take
los
care of
niños
the
y de
physical
las
health
familias.
aspects,
El
but
tema de
also
la
other
inserción
aspects related
escolar,
to
el
well-being of
tema de,
children and their
de los
families. So
exámenes a
staying in
tiempo para
school, making
fortalecer el
sure that they can
diagnóstico y
continue
prevenir de alguna
to be
forma o
tested and
mitigar de alguna
diagnosed in
forma
the best
la
possible way, because
discapacidad a la
that's
que se
always a
puedan
tool
enfrentar.
that mitigates
También
the
el tema
risks
de la
of
accesibilidad
potential
en los espacios.
disabilities. Also accessibility.
Donde se desarrollan la oncología. Solo los niños pueden referir a algunos hijos de padres con alguna discapacidad y tal vez
There
por
are
ello
sometimes
estén
children of
sufriendo del
parents with
cáncer. Entonces
disabilities,
creo,
and
como te
sometimes that
digo,
is the
Gustavo,
reason
como le
why
digo acá a todos
they
los
are
demás
suffering a
participatores,
specific type of
la
cancer.
discapacidad
There can
debe
be
ser
many
considerada
things,
desde el
but
inicio. Considerar el
disabilities have to be
tratamiento de
considered
forma
from the
integral,
outset.
así como
Treatment
el
must
principio de
always be
accesibilidad universal
comprehensive.
es para
Again, if we
todos. Los
consider the
niños no
principle of
deben escapar del
universal
primero.
accessibility, that
Debemos
includes
tener en
everyone,
consideración
including children.
que todos los
And that
ajustes
means
razonables sean
that
cubiertos,
all
incluso
necessary adjustments
aunque no
have to
haya
be
la
made,
necesidad, aunque no haya
even
surgido la
if
necesidad
there's
en esta
not a
población
need that has
producto de
arisen
los
yet in
tratamientos
this
que estén
particular
recibiendo.
population.
Muchas
But
gracias.
it could happen based on the treatment that they're following. Thank you. Thank you very much, Juan Angel. I think these are two key messages. First, not forgetting the role of families in terms of care and support. throughout
que
the
es
life
que sería
of
fundamental para
children.
su inclusión
So,
en la
and the
escuela
second,
y para prosperar.
accessibility, to
Bueno, pues
continue
para
their
la siguiente pregunta
education,
le
to
cedo de
stay
nuevo la palabra a
within
mi colega
society.
Liliana. Adelante,
Next, I would
Liliana.
like to turn it over to Liliana to continue with this
Muchísimas
discussion.
gracias y
Thank you
realmente
very much.
muy edificante ver cómo estas perspectivas
I think
van
it's truly
juntándose desde
edifying to see
diferentes
how the
aspectos,
different
diferentes ámbitos,
perspectives start to
para
come
seguir hablando
together as different
sobre este
pieces of a
tema tan
puzzle.
importante
And
que
now
es
to
que el modelo de
continue
cuidados
tackling
en
this
educación
very
y
important
servicios,
topic
como se
of
menciona en
care
SOAD,
models and
desde su
services, I would like
institución,
to
en este caso St.
ask
Jude, puede
again,
compartir algún
Soad,
ejemplo
from your
concreto
organization,
de
St.
reorganización
Jude,
de
could you
servicios o
share an
programas
example
que hayan concretamente mejorado la
of a
calidad de vida de
program
los
that has
pacientes y la
specifically allowed to
participación,
improve the
como ya lo hemos
quality of
mencionado
life
incluso
of
con el colega del RIADIS, de la
patients,
familia, ¿no? De los niños, de las niñas. ¿Qué
children, their
experiencias se ha
families?
tenido
What
desde
experiences
este
have you
framework
had in your
positivo de cáncer
organization
infantil internacional?
under this framework of international childhood cancer? Thank you very much, Liliana, once again. So from that perspective, an interesting example that we have in St. Jude's Children's Hospital has been including rehabilitation in the continuum of oncologic pediatric traditional treatment. Usually, rehabilitation only came after the child showed a disability or a limiting impairment. But St. Jude has in, implemented a model. I don't know if you can hear me better. Do confirm. Is this better? Okay, thank you. Well, traditionally, as I said, St. Jude has implemented a model for screening, functional assessment, and rehabilitation that are incorporated very early on in the treatment, and they are continuous, so that when there's remission, there's survival. The focus is no longer exclusively on the disease, but in the child's ability to participate in the regular appropriate activities for their age group. So learn, play, exercise, communicate, eat, and communicate with their environments. So we have a rehabilitation team led by Dr. Power, and this rehab team works together with oncologists, the nursing team, psychologists, and other healthcare professionals to identify very early on the limiting barriers, even when they are temporary, to prevent them becoming permanent. This is carried out through two programs. The first is accompaniment from the beginning, and this is done together with the palliative care team because we believe that offering relief during the treatment is very important from beginning to end. This has allowed us to move from a responsive to a preventive model that focuses on quality of life. And we have indicators and targets for rehabilitation that are worked together with the family and children to find what is important or a priority for them. So it's not only about physical function, but also social participation, their participation in school, making sure that the family is involved during and after the oncological treatment. One of the most important lessons learned is that the quality of service is not only measured in survival rate, but also the children's ability to continue participating in their daily life and reaching their best potential after
Muchísimas
they
gracias,
survive
Saad,
cancer
por
treatment.
esta,
Thank you very much,
por
Soad,
esta respuesta
for your
y
answer,
también para ayudarlos a conocer un poco más acerca de los
and
recursos
also for
que se ha
teaching us a little
construido
bit
desde los
more
últimos
about the
años en
programs
cáncer
that
infantil. Estamos
have
colocando
been designed
en el
for
chat para
childhood
todos
treatment. We
todo el
are
listado de
sharing
recursos que
here in the chat a
incluyen también
list
temas
of
de soporte y
resources
calidad
that
de vida de los
includes
pacientes,
quality of life and
como algunos
supporting
recursos
patients.
valiosísimos que muchos de las
These are
personas
very
participantes han
important
contribuido, como la
resources
biblioteca
that
de
many of our
Everly y muchos
participants
otros.
have
Así que les
contributed
invitamos a
with.
conocer
We have
también.
Emily's suitcase, La Maleta de Emily, for example, amongst others. Let us move on to our next set of questions. I would like to ask our dear Carlos Frias, founder and representative of this amazing Latin American network of survivors of childhood cancer called Faros de Vida. Let us also share in the chat his website so that you learn more about it. But Carlos, in the work that you do, what are the main fears and barriers that families express when cancer and disability intersect during treatment and in long-term
Claro.
survival?
Bueno, primero que nada, muchas gracias. Un honor, como siempre, poder
First of all,
participar
thank you. It's a
en esta
great
clase de
honor to
foros
be
tan
able to
importantes,
participate in
porque
this type
justamente,
of
como bien menciona y han
spaces,
mencionado
because
sus
as we
compañeras,
have
amigas
already
panelistas
heard
pasadas,
from our
es una
colleagues
situación
as
compleja que
speakers, this is
involucra
a
no
very
solo al
complex
paciente, sino a toda la
situation that not
familia,
only
y hablar
involves the patient,
específicamente
but
de
also the
cáncer y
families.
sobrevivencia
And when we
y
talk about
discapacidad es algo que, vaya, de repente no
cancer,
se domina
survivorship,
tanto.
disability, these are
Y que
things that are
realmente es
not so easy
importante
to
tenerlo en cuenta
handle. And it
porque,
is important to
vaya, muchas veces,
have them
al
in
menos
mind
desde
because sometimes, at
nuestra,
least from
desde nuestra
our
labor como Faros de Vida, trabajando
work as
específicamente
Faros
con
de Vida,
sobrevivientes,
working specifically with
la mayor parte
survivors,
de veces nosotros nos
most of the
encontramos con
times
chicos que
we
adquirieron
find
una
kids that
discapacidad debido
they
al cáncer o
had
debido a los
a
internismos mismos,
disability or
pero también
obtained a
existen muchos
disability
casos de
after the
chicos que ya
disease. But we
contaban
also
con
have
alguna
some other
discapacidad previa, ya
cases
sea
where they
cognitiva,
already had
motora o
a
de
previous
cualquier estilo,
disability of any kind
que
of
vaya,
disabilities,
complica aún
cognitive
más
or,
todo
sensorial.
difícil
And
y
this
complicado que de por
makes
sí ya es
everything
de
even more
repente el acceso
complicated. You know,
a
sometimes
la
access
salud dentro de
to
nuestra región.
the health system in
Por
a
ejemplo,
region may be challenging.
hablando
So
desde
when
la
we talk
cuestión
about
de la
from
detección, si ya
the
existe
detection,
alguna
if there
discapacidad
are
previa
any
existente en el
previous
chico, alguna
disability
discapacidad
on
cognitiva
the
o algo por el
child,
estilo
any
que le
cognitive
impida
disability or
expresarse
something
de
that will
manera
prevent
correcta
him
o de una
from
manera correcta,
expressing
sino de
himself
manera más
properly, not
clara,
not just not just
cuando
properly,
se
but to be
presentan
able to
algunos de los signos y
express
síntomas que
themselves
pueden
when
ser
they
confusos, incluso
have
por ser
certain
presentados
symptoms or
durante
signs, and
momentos
this could be
cruciales del
confusing
crecimiento y el
during
desarrollo de los
crucial
chicos. A veces se pueden
moments when the
confundir
children are
con
growing.
achaques
So
normales del
this may be
crecimiento, de
able
la pubertad,
this may be
de
confused
los
with
huesos y estas
other
cosas, pero
type of symptoms that they
eh,
may present when they are
partimos desde
growing
ahí.
up.
Como
So we need to start
una
from
discapacidad
there.
previa puede hacer
How
más compleja la detección
if they
temprana
have
de
a
algunos de estos
previous
signos o
disability,
síntomas
make
que van
things
apareciendo y que
more
pueden
complicated
confundirse
when we have
fácilmente
to
con otras cosas
detect
que
or
son más normales
diagnose
del crecimiento. Y
cancer, for example.
sabemos que
So
para que un
we
chico se
know that
cure
for a
es
child to
crucial
get
que se
ready, to
detecte a
get
tiempo. Entonces
healthy,
partamos
they
desde
need
allí.
we need to have a
Después,
timely uh,
agreguémosle que para en general en
diagnosis.
la
And
región, así los chicos
aside
tengan o
from
no una
that, in the
discapacidad
region,
previa, muchas
if
veces es
they have a
complicado el
previous
acceso
disability,
o
sometimes
el poder
access is even
llegar
more
a
complicated,
los
or the fact
sistemas de
that they
salud, a
can
los
get to
hospitales,
the
donde se
hospital, to
atienden
the health
directamente
systems where they
los
need to
cánceres,
get
¿no?
the
Hablando
attention or
desde
care
México y hablando
for cancer.
específicamente de
I'm talking
México,
about
en
Mexico
Guadalajara,
City,
en Jalisco, en mi
well,
estado,
Mexico and Guadalajara in
existen
Jalisco,
dos o
where I live.
tres, en mi
We
ciudad, dos o
have
tres
a
hospitales que
couple of
atienden
hospitals
al
that
cáncer infantil, pero
they take
hay
care of
chicos que tienen que venir
childhood
desde
cancer,
pueblos que
but there are
están a
some others that
horas
they need
de
to
la
come from
ciudad.
other towns,
eh,
hours away from the
y
city
sabemos que la
to get the
estructura de
proper care.
movilidad
And
en la
we know
región es
that the
complicada.
mobility
Ahora, para un
structure in the
chico que de por
region is
sí
complicated.
previamente
So
de
if
ese
we
lado
have a patient that
del
they,
desarrollo de
beyond that,
una
they have some
discapacidad
other
durante el
previous
tratamiento,
disability,
complica aún
well,
más
it makes
el que
things
puedan
even more
acceder e ir
complicated. The
a
fact that
tomar
they
sus
can access
tratamientos.
to
Y
treatment
lo que
in
incurre
general. So what
claramente en
happens
abandono,
is that
lo que
this will
incurre
be
de nuevo
left
en pérdidas de
in
vidas que no deberían
just
ser
not
así por
taking
falta
care of
de
them, or we
estructuras
may lose
que
lives
permitan a
because
chicos
there's a lot
poder
of
acceder.
structures, a
Ahora,
lack of structures that allow them to access
además
to
de
the
eso,
healthcare
claramente,
system. Now, also,
durante el tratamiento se adquiere
during
una
treatment, if
discapacidad
they
por la
acquired
toxicidad, se
a
genere alguna
disability
discapacidad
because of
cognitiva
the
o que tenga que ver
treatment
alguna
and they
clase de
have some
amputación o algo
cognitive
más físico,
disability or maybe
le
an
agregas al duelo de la
amputation,
familia y del
we
chico
add the
el
burden to the
duelo
family
por
and the
la vida
child,
pasada. Es decir,
the fact that they are always
¿cuántas
longing the
historias no
past
hemos
life. How
tenido
many
nosotros de
stories
chicos
we have heard
que su
about
sueño era ser un
children that their
futbolista, pero
dream
tuvieron
was to
cáncer y les
become a
tuvieron que
football
amputar una
player, and
pierna,
now
¿no? Y tener que
they
adaptar sus
had
sueños, su
cancer,
vida
and now they
y
had
todo
to
a esta nueva
lose a
condición
limb And
que si
if
bien
we
no es
add up all
limitante, no
this,
significa
even though
que
it's
no
not
vaya a ser
limiting and it
independiente
doesn't
jamás,
mean that
pero
he's not going to be
implica
independent when
el
he
doble
grows up, but
trabajo
it
para nosotros
implies
como
double
asociaciones civiles
work
y
for the civil
instituciones de la salud,
society and for health
tener en cuenta
institutions to work with that
que,
person,
vaya,
that we
se
need
entiende que
to,
durante el tratamiento
I mean, we
lo importante,
understand
lo
that
principal es
during
cuidar
treatment,
al
the most
chico,
important
si se
thing
tenga que
is
amputar
to
lo que se tenga que amputar, lo
help
que tenga
that
que
kid
trabajar, lo que se tenga que
to
trabajar.
survive.
Pero
If we
que
have
también
to
mientras se
amputate,
va
well,
haciendo
we
esto,
have
mientras
to do
la
it. But
discapacidad se va
while
presentando,
the disability is
hay
presented, we
que
need to work with them and
integrarla,
we
es
need to
importante integrarlo también a través
integrate the
de atención
patient
psicológica,
throughout
rehabilitación física
psychological
y
help,
demás para que el chico al
physical
final del tratamiento
treatment,
no se
and
quede como de, bueno, sí
so that at
sobreviví,
the end
pero
of
ya
the
no tengo
treatment they won't
piernas
go
o ya no
like,
tengo una
okay, now
pierna,
I
ya no puedo
survived, but
correr,
I
ya no
don't
puedo
have
jugar, ya no sé
my
cómo
legs, I don't
conducirme.
have a food, I
Es decir,
cannot be independent.
no podemos
So
enfocarnos solo
that
en
is,
curar al
we
chico,
cannot
sino también en
focus
hacer que
ourselves only to
independientemente de las
heal the
afectaciones
patient,
que
but
tenga,
also we
sean
need to
cognitivas,
take
sean
care of all
físicas
the other
y sean
uh,
muy graves o solo
late
sean
effects
estéticas,
or sequels that
es
might not be
importante
only aesthetic.
que se tome
It
en
is
cuenta y
important
se
that we
cubra al
bear in
chico
mind and that
para que
we try
conforme van
to
sucediendo las
work
cosas se
with the
pueda ir adaptando y al final
children
del
so that they can
tratamiento
adapt
esté curado
themselves to their
y
new
listo
lives.
también
And
para
at the end
poder
of the treatment, they're not only going to be
prepararse y
healed,
convertirse en una
but
persona
they're going
independiente
to be
que
ready to become an
pueda actuar
independent
por su
citizen
manera y
or
tomar el
independent
control de su propia
person,
salud
and they
y de
can
su
take
propia vida.
control of their own
Me
health
podría
and
extender más, pero
of their
bueno,
own life.
creo
Well,
que
this
voy a
is a little
dejarlo
bit
por
about
ahí.
what I wanted to say. I'm just going to leave it there. Thank you.
Muchísimas gracias, Carlos. Y me
Carlos,
resuena
thank you
mucho una
so
frase que
much.
escuché hace un
And
tiempo que decía
I remember this phrase I
sobre
heard
el
a
tema
long
de
time ago about the
sobrevivir,
survivors.
pero ¿a qué
I
costo?
survived, but what
¿Verdad?
is the cost?
Son reflexiones muy importantes, sobre
These are very
todo viniendo
important
desde la experiencia
reflections coming
vivida,
from the
¿no? De cáncer.
experience.
Así que mil
When you
gracias
go
por
through
estar
a
aquí, por
disease
la
like
valentía
cancer, you
de
have to think
expresar
about a lot of things. And
lo
thank
que
you
todos
so
nosotros
much for
queremos,
expressing
justamente mejorar,
everything
que la
that
atención
sometimes we
de
want
los
to
pacientes.
improve,
Entonces,
not
mil
only
gracias.
the
Y
care that we
tenemos una
provide
pregunta
to the
también
patients, but also the
para
after
Marcela
care.
Rodríguez Mariño.
Marcela, on the same
¿Qué estrategias consideras,
subject.
Marcela,
What are these
resultado
strategies,
efectivas para
Marcela,
lo que
that you consider
mencionaba,
are
¿verdad? Este
effective
afrontamiento
to what
emocional,
Carlos is saying, how
mantener
they
los
can
vínculos
face this
familiares entre el
emotional
aislamiento
new
social de los
moment?
niños?
How can they
Como
become
experiencia,
part of
bueno,
the
en
society? And as
conjunto
your
contigo y con otros
experience
colegas,
with,
vemos la publicación, la voy a poner
we
también
had
en el
this
chat,
publication
en
that
donde
I'm
se ve
going
que
to
más
share with
de
everyone on the chat, that more than
60-70% de los pacientes
60-70% of all
sobrevivientes de cáncer tenían una secuela
survivor
psicológica
patients, they had some
traducida por depresión, ansiedad
sequel,
y
that is
otros.
either
Entonces, ¿cómo afrontar
anxiety,
eso? ¿Qué estrategias
depression, and
consideras
many
que han
other
sido
symptoms. So,
efectivas en nuestros
what are the things
contextos?
that you consider have been effective in dealing with patients? Thank you so much for these. We know that this disease affects not only the patient, but also relatives, and it affects them by limiting the future. We also need to consider that these children are suppressed, so we have to be able to care for them differently. We cannot take care of them anywhere. And thirdly, even though that, for example, in Chile, we are considered a middle income country, the studies that we've done proves that the per capita income for family is just $100. Can you imagine? What can you do in a family facing cancer with $100? As part of the foundation, what we do is that we give them a comprehensive support or care, not only focus on the children, but also the family. First, from the rehab, we not only consider the cognitive and motor, but also emotional. As we heard a minute ago, we have so many side effects. Our rehab center includes professionals from sociology, occupational therapy, psychiatry, education, neuropsychology, nutrition, endocrinology, and also, well, as I said, psychologically. So we give them support to the family from the transportation so that they can get to our centers. We provide them with wheelchairs or anything that they may need so that they can be able to go to the centers. Patients, we invite them to come to the schools that we have inside the hospital. Next to the oncology unit, children are moved to this private place, and we can have them there in that school in the hospital that is close to next to the oncology center, and families can continue with their lives. Mom, after paying attention to the child, she can go back to the rest of the family and to pay attention to the rest of the family. And they need to be, sure that if the children present any symptoms, fever or something, we will bring them immediately to the hospital. Now, together with the support that we provide from the rehab center, we have a mental health program for moms. So moms can be supported in all cases so that they can know how to face this huge challenge. Let me tell you that our social workers, they work aligned with all the rest of the social workers in the oncology units in Chile. So for that, we have access to know exactly what are the other needs to the family, and we help them not only on the emotional and nutritional facts, but also all the emotional needs that the rest of the family may require in order to receive a children that may have a specific needs, for example, to move around in the house with a wheelchair. So we try to help them in a more comprehensive manner, and we are trying to do our best so that those patients, they can become part of the community in the best possible way, and they can be part again of the school life, social life, because after treating that patients, if they don't have any future, we're not doing our jobs completely. So this is why we try to work with them from the social reintegration point of view. Even when there is an amputation, we try to help them with a prosthesis. So this has to be comprehensive, a holistic approach, integrating every family member. And as we were saying, we heard from Carlos, all the aspects from the patient's point of view and the family's point of view.
Y gracias,
That is
Marcela.
fantastic, Marcela.
Maravilloso.
Thank you
Muy
so
aleccionante
much.
todo lo que nos comentas y tenemos más
This is
preguntas.
so
Le voy
interesting
a dar
of
pase
everything that you're
a
saying, and I
Gustavo
believe
para
that
seguir con
we
la
have more
discusión.
questions. Gustavo,
Genial, la verdad es que
you
están saliendo
have the
como
floor
temas muy,
now.
muy interesantes.
We
Ojalá
have
también
very
hacemos
interesting
vuestras
comments
preguntas si tenéis
on the
preguntas
chat.
con respecto
Now,
a los
if you have any
panelistas. Y bueno,
questions
vamos a cambiar un
specifically to
poquito
the
el
panelists,
tercio
you
de
can
juego,
ask
¿no?
them
Nos
on the
vamos a ir
Q&A
ahora
section.
sobre derechos
Now,
humanos.
let's talk
Realmente,
about
cuando
human
hablamos de
rights.
discapacidad,
When we talk
estamos
about the
hablando específicamente
disability,
de unos
we are
derechos, ¿no? De
especially
derechos humanos
talking
de personas
about
que tienen el
a
mismo derecho
human
que las
right, that they
personas
have
sin
the same
discapacidad para
rights
acceder a servicios,
in
¿verdad?
order to access
Entonces, esta pregunta
services.
o esta
So
cuestión de
these
tranquilidad
two
ahora va
questions
para
that
nuestro
I'm
colega
going
de
to ask
RIADIS,
are from the
Juan Ángel.
RIADIS, from
Y
to
la
Juan
primera
Ángel, and
pregunta me
are the
gustaría
first
saber cuáles
question:
son las implicaciones
what are the
que tiene reconocer
implications that we
el cáncer
need
infantil
to
desde el momento del diagnóstico como
recognize
una situación
in
que
terms of
efectivamente
childhood cancer
genera discapacidad y
as
por
something
tanto
that
activa
generates
derechos
disability,
concretos,
and
¿no? Ya
it
sea prestación de
activates
limpieza,
certain
adaptación
type of
educativa,
human
apoyo
rights, that
específico,
is
todo eso. Si queréis,
education, special
adelante,
support,
adelante, te escuchamos.
social support, etc. We hear you.
Gracias, Gustavo. Sí, bueno, primero quería decir
Thank
que
you,
estoy de acuerdo con lo
Gustavo.
que
First of all, let
expresaron
me say that I
mis
fully
compañeros
agree with
panelistas
my two
anteriores.
previous colleagues
Efectivamente, hay que
that
preparar
indeed we
a
have to
estos niños para la
prepare
autonomía. Y
these
justamente
patients
eso es
for
una de las
to become
implicaciones más
autonomous.
importantes
And one of
de
the
que se
main
pueda
implications,
reconocer el
first of all, is
cáncer
that we have
como
to
un generador de
recognize that
discapacidad
cancer
desde el
is
primer
a
momento, desde
disability
su diagnóstico.
generator from the
Incluso
moment of the
hay niños que
diagnosis.
pueden estar
There are some
sufriendo de algunas
children that they may
condiciones de
be suffering
discapacidad,
from
entendiendo la
certain
discapacidad como un
disability
concepto
conditions,
que
in understanding
enfrentan barreras
disability, that they are
debido a las
facing
limitaciones del
barriers or
tronco, incluso
limitations
antes de saber que su diagnóstico
even
corresponde
before
a
that the
cáncer.
diagnosis
Y es por ello que
it's cancer.
los gobiernos
So
nos
this is
deberíamos
why
estar todos
governments, we
unidos
should
en que se
be
haga
getting
la certificación de la
together, and that
discapacidad
we can
de forma
certify
inmediata,
disability
una vez que se
afterwards, that is
considera el
immediately after
diagnóstico.
the
Eso sería un
diagnosis of
cambio de
cancer. this could be a change of paradigm that is very important because we will stop seeing them as the disability as a consequence, and we will see them as a reality. And this will require to activate the protection systems of many states and governments. As we have heard, there are some hospitals that they even have schools inside the hospital so that we can help them go back to their daily activities, and they can guarantee somehow that they are considered the right to education. But not only that, something that we heard about the rehabilitation systems during treatment are also very important to prepare the child. For example, if at some point they have a tumor that will affect their bone structure and that would prevent him from moving around or with reduced mobility. So rehabilitation during treatment is going to generate in comprehensive care so that they can become independent persons. Not only are we talking about education adaptation, but also adaptation in terms of health, physical, and the social support, for example, that the programs are addressed to people with disabilities. And sometimes they are addressed specifically to a general disability, as we mentioned, but they should have the certification. They should be certified as persons with disability. So this is why we believe that the most important right that we need to guarantee to our children is to build an autonomous life and a honored life. So as part of the structure, this needs to be focused to that. This includes, as we were saying, everything that we talked about, all the adaptations, all the necessary things, and the certification. This is one of the most important things, that somehow we can um, give some testament that disability is present even before the diagnosis, during the diagnosis or during treatment, and we have to consider whether if there are any side effects as part of the remission stage, well, also to be able to take care of them. Thank you.
Muchísimas gracias, Juan Ángel. Pues sí, esta pregunta va de nuevo para ti, ¿no? Desde el enfoque de derechos humanos y de la Convención sobre los
Thank
derechos de
you
las
very
personas
much, Juan
con
Angel. This
discapacidad,
question
que
also for
precisamente este
you
año
from the
cumple
perspective of
20
of human rights and the
¿Qué
Convention on the
cambios
Rights of Persons
normativos o
with
de política
Disabilities,
se
which is
consideran
turning
o se
20 this
incluyen
year.
para
What
garantizar
regulatory or
precisamente este
policy
impulso
changes do you
de la que
consider
tú
a
me has
priority in
hablado,
the
ya sea
region
de
to ensure
educación, de protección
these
social,
changes that you're
recursos
talking
efectivos en
about,
salud para estas
educational
personas
inclusion,
sobrevivientes de
social
cáncer infantil?
protection, continuity of care for childhood cancer survivors?
Sí, bueno, Gustavo, aprovecho de mencionar que estamos en
Thank you,
el
Gustavo.
20 aniversario de la
I think it is
Convención,
worth mentioning that
que
we
acabamos
are
de, hemos
celebrating the
indultado a
20th
todos, desde
anniversary
RIADIS
of
hemos
the
hecho una
CRPD.
bandera
It
en
has
toda la
involved
región, en toda
all
la
of
América
us.
Latina,
RIADIS
para
has
continuar
truly taken it
fortaleciendo
as
las
part of our
políticas
work
de los
in the
estados en el
region to
cumplimiento
continue
o en la
strengthen the
armonización legal de lo
policies
que
of
establece la
states
Convención.
so that they
Como bien
have the
dice, se deben
legal
realizar
harmonization
algunos ajustes
necessary
y
to meet
parte
with
de lo que
the
estábamos
convention.
hablando en la
And part of what
pregunta
we were
anterior, parte
discussing
por considerar
already,
que el
I
cáncer
touched on
infantil
in
no
the
es
previous question.
solamente un asunto
Childhood
médico
cancer
o un
is not
asunto de
only a
emergencia, sino que
medical
está
issue or an
vinculado al
emergency
tema de
issue.
derechos humanos, que
It
no está
has a very strong
desconectado de lo que
connection with
sería la
human
inclusión
rights.
social
It has
y,
everything
digamos,
to
de alguna
do
forma
with
la
social
atención o
inclusion
la,
and
el diseño de políticas
somehow care
equitativas para
and
la atención de los
designing
niños. Debe
equitable
garantizarse,
policies for
como
children
reafirmo lo
must
que estaba diciendo
guarantee
anteriormente, los
this
temas de certificación. Las leyes
these
actuales
aspects such as
probablemente en algunos
certification that I
países
mentioned before, and I know
necesita,
that
digamos, tener
legislation
alguna
in many
condición
countries
permanente o cumplir con
have
algunas
to already have
normativas,
some
pero debería
changes in
establecerse
order
una
to meet
certificación
with certain
inmediata
obligations,
para los
but there
niños con
has to be
enfermedades
an
graves o
immediate
con
certification for
diagnósticos
children with
importantes de cáncer,
serious
aunque esta certificación
diseases,
sea
with
transitoria,
important
digamos que
cancer
establezca un lapso,
diagnostics,
un periodo,
even if the
mientras se evalúa el
certification is
desarrollo del niño.
temporary
Se debe
while there is
también
an
mejorar el tema de
assessment
las leyes
of
en
the
educación.
child.
La educación
Also,
inclusiva ha sido un tema
laws
que en
on
RIADIS también hemos
education
venido
have to
trabajando
be
y los
improved.
niños con cáncer no
Inclusive
pueden estar,
education has to be
digamos,
stronger.
ausentes de ese sistema de educación
Children
inclusiva.
with
Se
cancer
debe exigir
cannot be
a los
taken
gobiernos, a
out of
las
the
escuelas
education
ordinarias,
systems.
también tengan algunos
Governments must
ajustes
demand
razonables que
schools to
sean de
make
carácter obligatorio
reasonable
para que se puedan
adjustments
incorporar a los
in a
sobrevivientes de cáncer,
mandatory
pero
fashion so that
considerando
cancer
dentro de los
survivors
ajustes
can be
razonables,
incorporated.
flexibilización
And of
de
course, as part
horarios,
of the
de carga
reasonable
académica,
adjustments, that
digamos,
involves
el tiempo que
mm,
sea necesario. Esto
scheduling,
para que funcione de una mejor manera
for
debe estar
instance,
normado, debe
while
existir
it
la
is
ley para
necessary.
que se
But
pueda
in order for
cumplir
this to be a
adecuadamente.
reality, it has
De
to
la
be
misma forma
regulated, it
que el
has to
tema de
be
pensiones
considered
o
in
apoyos sociales
legislation. And the
que
same thing
son
goes for
dirigidos a los
pension
niños
schemes or
con
other
cáncer o
forms of
niños con
social
discapacidad,
protection
deben
for
considerar de
children
nuevo a
with
la
cancer or
familia como un
children with
elemento importante.
disabilities. Again,
Elemento
families
que puede dar
must not be
de
neglected
alguna forma
because
una estructura de cuáles son
somehow
realmente las
they are part
necesidades
of
de
the
una familia.
structure
Alguien lo
that
mencionó aquí
allows us
ahora,
to
el
understand
presupuesto.
fully the needs
El
of a
presupuesto
family.
para una
Someone
familia
already
que tiene un
mentioned
niño con
a
cáncer
budget, for
es
instance. The
realmente
budget
limitado,
for
más
a
en nuestros
family that
países en
has
América
a
Latina hay
child with
muchos países
cancer
que están sumidos
suffers
en
a
una pobreza
severe
extrema
hit. There are
porque la
many
familia
people
donde
with
surge
extreme
el niño
poverty in
con la
our
condición de
region.
discapacidad o
And
con la
if
enfermedad
you
de
have a
cáncer
child with a
termina en una
disability
pobreza
with
extrema. Entonces
cancer
debe
in a
realmente
family
garantizarse
living in
sistemas de
extreme
protección
poverty, there must
interseccionales
be
que no solamente
intersectional
aborden el tema de la
protection
discapacidad o aborden
mechanisms
el
that
tema
can
del cáncer,
support
sino que
not only
puedan
in
verlo
terms of
como
the
una posibilidad
disability or
que
the
viene
cancer
unida.
treatment, but
Asimismo,
all of it together.
los sistemas también que proveen de alguna forma
Systems
la continuidad de la atención, porque bueno,
that
deja de ser
somehow
infantil cuando ya
offered
llega
a
a la mayoría de edad,
continuity
dependiendo de
of
la edad que
care
considere
are
cada
also
país. Por
important
ejemplo,
because we know
el
that
país donde yo
when a
soy,
child comes
Venezuela,
of age,
es
and
hasta
that
los
varies
18 años de
depending on
edad.
what
¿Qué
country we're in. I'm
consideraciones
from
debería haber en
Venezuela,
esa
which is when children
transición
turn
de
18, they
un
are
paciente que tiene
considered
una
adults. So,
remisión o que
what happens in the
probablemente
transition
continúa
of
con
a
un
patient
tratamiento que
that
pasa de
maybe
los
will
18 años?
continue
Entonces, para
in
nosotros son
treatment
elementos
when they
importantes
turn
que
18?
deben ser
All of these are
considerados en
important
todos los países, en
considerations
todos los
in for
gobiernos
every
y en los
country, for
sistemas
every
públicos que
government,
consideran tanto a la infancia como a la
or a
juventud,
system
podemos
that's
decirlo de
in
esta forma,
charge of
que tienen
protecting
cáncer y que pueden
childhood
presentar
and
diferentes
young
discapacidades.
people
Muchas
and who
gracias.
may face the
Muchísimas
possibility of
gracias,
a
Juan Ángel.
disability.
Sí,
Thank
es
you. Thank you
fundamental
very much,
insistir
Juan
en la
Angel.
idea de que
I
una
think
persona,
it's
un niño
really
o una niña con
important to
discapacidad,
insist
no
on
es
this.
solamente una persona con un
A
certificado que le
child,
acredita
an
como que tiene una
adolescent with
discapacidad y por lo
cancer
tanto
is not only
derecho a
someone
una
that
serie de
has a
beneficios. Creo que
disability
la
and
visión de los
therefore
derechos
has the
humanos va
right
mucho
to
más
a
allá de
variety of
apoyar las
services. I
políticas,
think having a
va a
human
trabajar
rights
también en el marco
perspective
de la
means
gobernanza, de
changing
la
policies,
financiación, de los
improving
modelos de
governance,
cuidado, de los servicios que
improving
se suministran,
funding,
incluso de
models for
investigación,
care,
que de eso
even
también nos puede hablar.
research.
Y yo creo que,
That's
como decía también
another whole
Marcela,
topic for
se trata de un
discussion. I
enfoque
think, as Marcela
multidisciplinar
said before, it's
donde
a
todos desde nuestra posición
multidisciplinary
tenemos que
approach that
incidir,
is
¿no?
necessary, and
Bueno,
all of us
pues
with our
vamos a
different
terminar con una pregunta
professions
que en este
must
caso va
make an
para
impact.
todos, ¿no?
And
Vamos,
we
vamos a
will
aprovechar que
close
nos
with a
escucha
question
tanta
for
gente, que tenemos aquí
everyone.
personas que
We want
trabajan
to
en los
take advantage
ministerios,
of the
que
fact
vamos
that
a
we
dar la
have
voz
here
también a otros, ¿verdad?
representatives of
Entonces,
ministries and
yo lanzo
many
una
sectors of
pregunta.
society. So
Si
the
tuvierais que
question is,
mencionar
if you
una
had to
prioridad
name
concreta de acción
one specific
conjunta entre
priority for
hospitales,
joint action
investigadores,
among
organizaciones de
hospitals,
familia, redes de personas con
researchers, family
discapacidad,
organizations,
para los
networks
próximos
of people
5
with
años,
disabilities
¿cuál
for the
sería?
next
¿Cuál sería
5 years,
prioridad y por qué?
what
¿De
would that
acuerdo?
priority
Bueno,
be
pues entonces
and
vamos a
why?
comenzar preguntándole a Carlos.
I
Adelante,
will
Carlos.
start by asking the question to Carlos. Over to you, Carlos.
Gracias.
Thank you.
Muy buena pregunta,
Thank you. And
bastante,
that
digo, teniendo en
is
cuenta
a
lo
very
amplio,
good question.
pero creo que la urgencia
Considering
actual
the
sería
diversity of needs, it's
cosas como lo que
difficult.
estamos
But
haciendo
if we
ahora, es
think of the
decir,
most
primero
urgent things right
ponerlo en
now,
el
I think that
mapa,
what we're doing right
que
now,
las
so first
instituciones se
making
den
sure
cuenta
that
de las necesidades que
institutions
existen más
become
allá de las
aware
obvias.
of the needs that
Y
exist
yo
beyond the
diría que
most
la
obvious
parte de la
ones. And
accesibilidad,
I would
y no
say
solo la
that
cuestión de poner rampas
accessibility,
y
and it's not only
elevadores y
about
demás,
having
sino
ramps
también la
or
cuestión de la accesibilidad
elevators, lifts.
referente
No, it's
al cómo se
accessibility
relacionan
regarding
también los médicos con estos
even
chicos que ya
the
presentan
relationship
discapacidades,
between
el
the
poder también
physicians
adaptar
and these
la
children with
comunicación
disabilities. So
y
adapting
el tratamiento
communication, adapting
psicológico o
patient
de
care,
reintegración que se le dé al
psychological
chico
treatment
para que vaya, además de
that is
poder
offered
llegar
to the
al hospital
child
o recibir
so
sus
that,
tratamientos con las
okay,
menores
beyond
complicaciones
being in the
posibles, que
hospital and
también
being able to
a partir del
receive his
tratamiento
treatment in the best possible way, which is
no
the
parto de
most
cero, sino que
basic
desde el
thing, treating, but making sure that the treatment already adapts many different things or helps the child to adapt to the new life that he or she will have
Estupendo,
with the
muchísimas gracias,
impacts
Carlos.
that
Pues misma pregunta
the
para
cancer will
Marcela.
have in their
Adelante,
lives.
Marcela. Misma
Thank
pregunta
you,
para ti.
Carlos. Same question. Now over to you, Marcela. Thank you. I think that, again, like collaboration, joint action, I think that's a priority. I would love to know, I would love for everyone to do research to understand what is happening in terms of rehabilitation in all countries. Is rehabilitation efficient, multidisciplinary? Is it considered a right of the child? There must be public-private partnerships in order to provide better service, as we have done in Chile. We know that children may have impacts later on in their lives, so making sure that the consequences are monitored. Rehabilitation must happen at an early stage. It must be very intensive in order to get the best results. One time I saw the case of a child. He had leukemia and he looked very healthy. And he came to our rehab centers and we asked him, like, why are you even here? And he said, well, I have never been able to have physical education class again. I get fatigued extremely quickly. And what happens is that once the children uh, go through these experiences, we know that having a healthy lifestyle is important, and that includes exercise, food. And so we have to make sure that these children do not lose access to these things so that they can live their lives fully. And that's why we need to remind ourselves that this is a right. Also, understanding that a 60% survival rate is not enough. We have to aim higher. We have to guarantee the survival of more children, and we have to do advocacy so that states start thinking about the importance of rehabilitation, because again, survival is not enough. And also, we have to consider, as is the case in Chile, that our population is aging. And if we have children who will be living in conditions that will not allow them to contribute to society, then that's a problem. If we already know that for every dollar we invest in cancer treatment, we get $3 back, but that will not be true if we do not rehabilitate. Thank you, Marcela. We in PAHO understand that rehabilitation must be present throughout the life cycle of the individual so that they not only reincorporate in to society, but that they can continue living as years go by. Thank you, Gustavo. Everyone has already stated very important things. If I had to pick one single priority for the next 5 years, I think incorporating functional diagnostic, social inclusion, and rehabilitation as part of the standard of care for children from the moment of the diagnosis to survival. I think each of the panelists, Carlos, Marcela, Juan Angel, have all mentioned very important aspects of this. And I think it's not work only for oncologists or for the hospitals, or I think this is work that requires joint action between civil society organizations, government authorities, because many children survive cancer but do not receive the necessary support to go back to school, to continue playing or exercising or participating in their families or in their communities. That's very complex for children who already had a disability even before their cancer treatment. But I think no single organization can solve this. Hospitals provide clinical care and rehabilitation, but civil society organizations, parent organizations can help identify the real needs on the ground. Survival groups, as the one led by Carlos, Faros de Vida, they can support caregivers, organizations of people with disabilities, so that knowledge is shared that leads to inclusion, better accessibility, better community participation. The goal would be for me to have care models that not only measure survival, but functionality, quality of life, and the participation of children and adolescents in a variety of activities. Last week, we were with Lily in a workshop at the Congress of the Radiology Society, and we had a meeting of the global initiative before that. And one of the groups that was invited to speak was a foundation. And what really called my attention is that in Mexico, there's a strong group working on rehabilitation, and they do activities such as the Teleton. The government of Quintana Roo, which is where the event was being hosted, has specific activities for children who have consequences because of secondary neuropathies after receiving treatment. They have ankylosis and they were being rehabilitated and participated in activities to improve their quality of life. These are just specific examples of where we should be headed, what we should aim to achieve as a society, as governments, in order to have a better model, to strengthen the transition, and to make sure that in the future, more children not only survive cancer, but have the opportunity to live their lives
De acuerdo,
fully
muchísimas
and reach
gracias,
their highest
Soad. Yo creo
potential.
que tenemos tarea
Thank you,
que hacer
Dr.
porque es
Soad. We
importante que estas buenas
agree. And
prácticas que estamos
Liliana, I
instalando
think we have a lot
realmente
of homework that
bueno,
we
pues
can
lleguen
take
a
with
otros
us
países, a
because
otras
these
realidades
best
y bueno,
practices need
esto
to reach
supone no el
other
fin del mundo, sino el
countries.
principio de
And
una tarea
this
que tenemos
is,
por
of
delante.
course, not the
Bueno, pues
end, but
misma
rather
pregunta
the beginning of
Juan
a lot
Ángel.
of work.
Adelante, Juan Ángel.
Same question, but now for Juan Ángel.
Sí, creo
Go
que,
ahead, Juan
Gustavo,
Ángel.
gracias de nuevo.
Yes,
Lo que
Gustavo,
acaba de
thank
decir
you.
Suat es
What
fundamental. La unión, el
Suad
trabajo en
said
conjunto.
is very
Creo que es
important.
prioritario y bueno,
I
como
think
está la
working
pregunta
together
basada,
is a
digamos, en los
priority.
próximos 5 años,
And
creo
in
que
the
hay
next 5 years,
5 acciones
which is your
fundamentales
question,
que
I think
lo
the
voy a definir
priority
de
should
esta
be
forma.
5 steps.
Hay
I
que
will say it like
identificar,
this.
continuar identificando a través de la investigación, a
We
través
have
del
to
monitoreo, cuáles son las
identify
barreras,
behind
cuáles son las
investigation what are the
necesidades
real
puntuales de
barriers,
esta
what are the
población,
specific
no
needs of
solo
this
de los niños,
population,
sino también de sus
not only
familiares,
about
para
children, but also the
visibilizarla, como lo
families,
había
so
comentado
that we
Carlos.
can make
Hay que
visible, as
visibilizar
Carlos
la
mentioned,
situación, porque
we need
muchas veces
to make the situation
ya
visible
la
because
discapacidad
sometimes
ha venido siendo muchas veces
disability
invisibilizada en distintos
sometimes
espacios
is not
y
visible
creo
in
que
certain
aunado
spaces. And I think that
a la
together
oncología infantil
with
está
the
siendo todavía
pediatric oncology
invisibilizada.
is even
Asimismo,
more invisible.
promover
So this is why
adecuaciones,
we have to
ajustes,
promote
adaptaciones es otra de las
adjustments,
acciones importantes.
adequations.
Blindar
This is one of the
jurídicamente
other
que todos los elementos jurídicos, las
uh,
leyes sean
tasks, to be
actualizados,
able
que las
to
normas sean
help
también
them on the
de alguna
legal
forma
aspect, that all
transformadas
the
de manera
society can be
transversal para
transformed
lograr la atención
in order
inmediata
to
de los niños con cáncer
manage immediate
desde el
attention
diagnóstico y no solo
for children
esperar,
with cancer
digamos,
from
que
the
sea una
diagnosis
consecuencia
and not to wait
irreversible
until
o que
this
sea
is
un
an
niño que sea
irreversible
permanente
consequence or it's
para
a
que puedan
permanent
tener acceso
disability
a
so
las
that they
diferentes
can have access
prestaciones o apoyos
to the
sociales que
different
podamos
type
tener en
of
algunos
uh,
gobiernos. Y
care that,
luego,
we
bueno,
need to provide
reafirmar la
this
necesidad de trabajar de manera
these
conjunta
children
y
and
creo que
also
para
to
trabajar de manera
work all
conjunta también
together
es importante
as a
considerar a los
team. And
actores
it is
clave.
also important
Los
to
actores
consider the
clave,
key
digamos, deben ser
stakeholders,
los
the
gobiernos,
key
los
actors,
estados, los
governments,
sistemas de salud,
states,
no
health
solo los
systems,
nacionales,
not
sino
only
también
the
los
national
regionales,
health systems, but also
internacionales, que de
regional,
alguna forma
international, that
puedan, a
somehow
través de
they
esa
can help
incidencia,
us
lograr que
to
cada estado
manage that
asuma
each
la
state can
responsabilidad
be
y
able
asuma
to
las
be
políticas.
responsible of the
Muchísimas
care.
gracias, Juan Ángel. La verdad que creo que
Thank
hemos
you,
tocado
Juan
todos los
Ángel.
ámbitos, ¿no? El
I think that
trabajo
we
que
have
está
touched upon
Necesario
all the
para liderar.
aspects.
Y en las
Oh,
organizaciones de personas con discapacidad. ¿Aló?
uh,
Sí, disculpe.
sí, ahora
sorry,
sí.
we lost her for a
Perdón,
minute.
estábamos
Adelante, adelante,
teniendo
Juan Ángel.
We're
problemas.
losing you.
Sí, bueno,
Sorry.
no
Okay,
sé
well,
hasta dónde me lograron, nos lograron
I
escuchar,
don't
pero
know
bueno,
what was
quería
the last thing that
cerrar con la
you
parte
heard
del
from me, but I
plan,
just wanted to
de los
say
gobiernos, los
about the
sistemas
key
de salud,
stakeholders,
las
governments,
organizaciones de
health
personas con
systems,
discapacidad,
the
las
organizations
organizaciones de familiares de
of
personas
persons
con
with
discapacidad y las
disabilities,
organizaciones
families
de
with
sobrevivientes.
persons with
Creo que estos
disabilities, and
son
also the
actores importantes
survivor
para definir
organizations.
esos temas, identificar
This
esas
is something
barreras,
that we
esos
need
desafíos de
to work all
viabilidad,
together to
pero también
identify
para
the barriers, to
visibilizar lo que
identify
hay
what we need to do and to make visible what do we have available in each country for comprehensive care, and what do we need to do in order to help those persons with disabilities. I hope that you can hear me, and I'm super happy to be here participating. Thank you, Juan Angel, and the interpreter. Otherwise, we wouldn't been able to hear you. So thank you so much. And well, as part of what we have heard today, we have touched upon very important topics. How can we integrate all these topics? We have a lot of tasks ahead of us, and I was listening to the conversation, and the most important thing is that we can continue with our work, the social work with the institutions, hospitals, organizations, civil society, but also ministries and governments. Well, now I'm going to turn it over to Liliana, because I think that she has something very important to share with us around this important experience. Liliana. Thank you, everyone. This has been a fantastic conversation, because we can there are a lot of things that we need to reflect on, and the most important thing, the term disability and childhood cancer sometimes are seen as two different topics, but they need to be seen as one thing. They cannot be part of different agendas. So I just wanted to share with you a video to leave this conversation a bit more motivated, and to think about all these perspectives that we are sharing with everyone today. And of course, I'd like to thank all our speakers, because I believe that it's been incredible to have you all here. But I'm going to share a very short video that reflects the feeling of many patients that they undergo a oncology treatment, and what it means to have a disability and how you can overcome it.
Tenía 13 años cuando me diagnosticaron el linfoma no-Hodgkin, un tipo Burkitt. Luego de realizarme una cirugía, descubrieron que lo que yo tenía era cáncer. Mi papá afortunadamente decidió llevarme a Santiago, que es la capital de Chile. Eso traía la consecuencia de que tenía que trasladarme del lugar de donde vivo, y dejar a mi familia fue el proceso más duro en ese momento que tuve que enfrentar.
Muchos no lo saben, pero este proceso no termina ahí. 1 de cada 3 sobrevivientes de cáncer infantil desarrollará una condición crónica de salud, como problemas cardíacos y pulmonares, afectación cognitiva y psicológica, entre otras, que tendrán un impacto en su calidad de vida. Luego de recibir un tratamiento intensivo por 7 meses, Valesca logró superar el cáncer, pero aún tenía un duro camino por recorrer.
La etapa del posttratamiento también es una etapa importante, pero de la que no se habla mucho. A nivel social tuve dificultades para incorporarme en el ámbito escolar. Me costó mucho el volver a estudiar, la concentración, la memoria, la atención. A nivel familiar no puedo tener hijos producto del cáncer. A nivel físico tengo cardiopatías asociadas, y todo eso va afectando en el desarrollo que he tenido a lo largo de estos años. Y me hubiese encantado haber tenido en ese momento el apoyo de una red de sobrevivientes de cáncer que me hubiesen guiado y acompañado en ese proceso, haberme escuchado y sentirme escuchada por gente que conoce del tema y que me hubiese entendido como yo quería que me entendieran.
En el 2020, Valesca participó en un encuentro del Childhood Cancer International, donde escuchó testimonios de otros pacientes de la región. Sus preocupaciones, pese a las diferentes realidades, eran muy similares. Así nació Faros de Vida, una red latinoamericana dentro de Childhood Cancer International, que conecta sobrevivientes de cáncer infantil en la región de las Américas y promueve la detección oportuna de los efectos tardíos del tratamiento oncológico.
Para mí, Faros de Vida ha sido una red que ha sido mi red de contención y de apoyo, y no tan solo me ha servido para cambiar o intercambiar experiencias, sino que también para generar cambios positivos en todos los sobrevivientes de cáncer. Por eso es súper importante que se sumen más jóvenes, adolescentes y adultos sobrevivientes de cáncer infantil, para que todos juntos podamos generar el cambio en nuestra calidad de vida y entregar mejores condiciones que son las que necesitamos para tener una mejor vida.
La red está conformada por más de 80 jóvenes de diferentes países, incluidos Chile, México, Ecuador, Venezuela, Bolivia, Colombia y Honduras. La Organización Panamericana de la Salud, junto con Childhood Cancer International, el programa Juntos by St. Jude y organizaciones a nivel global, realiza un trabajo articulado para optimizar el seguimiento de los niños y adolescentes que han recibido un tratamiento oncológico y proveerles de recursos educativos y herramientas que sean promotores del cuidado de su salud. Además, promueven la concientización y vigilancia adecuada de los profesionales de la salud y público en general sobre las secuelas de la enfermedad. La recuperación de un niño, niña o adolescente con cáncer es posible, y una mejor calidad de vida después de la enfermedad también. Así como Valesca, tú también puedes sumarte a compartir la voz de los sobrevivientes.
Los testimonios son poderosos ejemplos de resiliencia que brindan apoyo, conocimiento y también acompañamiento a las personas que transitan por la enfermedad del cáncer. No estás solo, únete a nuestra red Faros de Vida.
Bueno, muchísimas gracias. Creo que ha sido
Thank
muy
you
inspirador
so
esta
much. I
sesión.
think that this video is very inspiring to be able to hear this testimony. Thank you all our speakers for your perspectives. I think that we take back a lot of activities and we have a homework for everyone. So Gustavo, you have the floor for the closing words.
Espectacular porque da un mensaje muy claro, ¿no? Y que creo que
Liliana,
nos
this is a very
bueno, pues
clear
al final
message.
espacio
Is
creo que
something
nos
that we all need to
más que
work on.
información.
We finish this seminar with more than information, a lot of learning, and mainly our shared responsibility. We have to talk about disability and childhood cancer. It's not only about talking about medical challenges, but also to recognize social, emotional, and structural barriers that many families face on a daily basis. In this path, the civil society organizations, they play an important role. They are the bridge, they are companions, and sometimes the first line of contention. So with this, they make visible, so sometimes it is hidden. They defend rights, they build opportunities where before there was only an empty space. So thanks to that, the care becomes more human, closer, and let us continue to strengthen these spaces where we can listen to ourselves, because only working together we may move forward towards an inclusive environment where each child may receive not only treatment, but also access to a life full of opportunities. So thank you, everyone. Thank you for your participation. I believe that aside from the great participation numbers, we had more than 400 people connected from many countries from the region. I think that this has been a very important lesson, and we have a huge task ahead of us. All those institutions that are here present, we need to work all together. Thank you again to our panelists, my colleague Liliana, that we've worked very hard in order to prepare this webinar, our team from COMS, our interpreters, thank you, and thank you all of those who have participated in this webinar. Thank you, and see you all very soon. Have a great day ahead. Thank you.